Endoscopy is a general term that encompasses both the gastroscopy, with the scope going through the mouth, down your esophagus to the stomach, and colonoscopy, which is a scope that goes through the back passages to look at your entire colon. So both the scopes together, the gastroscopy and the colonoscopy together form an overall umbrella called the endoscopy. I think people have to be aware that the procedures are very safe and the procedures are very comfortable for the patient in terms of we do give sedation or an injection to numb the effects of the scope going through the bowel. So the patient is almost totally not aware that the scope is being done, and when they wake up, the procedure is done and the results are in front of them. So that's one of the biggest fears of patients in terms of colonoscopy and gastroscopy procedures. Secondly, in terms of the complications of these procedures, they are invasive, yes, but the complications rates are very low. They are about 1 in 2 to 5,000 chance. You have 1 in 2 or 1,000 or 1 in 5,000 chance of developing a complication. These are the two main factors which prevent or inhibit people from coming in for a scope. Okay, so the recommendations have been nicely spelled out in the Ministry of Health guidelines. So the Ministry of Health guidelines actually state that every single person in Singapore should have a colonoscopy done when they reach the age of 50. So this is excluding, these are patients without any symptoms. The symptoms which will include bleeding per rectum or bleeding through your back passages when you go to the toilet, abdominal pain, loss of weight, or nausea and vomiting. So these are all alarm symptoms that require a scope. So the Ministry of Health guidelines actually state that those patients without any symptoms should have a colonoscopy done above 50 years old. To reduce the confusion, all patients or all people should have colonoscopy done when they have symptoms regardless of age. Okay, I am personally seeing an increasing trend in colorectal cancers. I am also seeing a lot of literature that are published around this region, in Singapore, in Asia, and in the broader context, Europe and the rest of the world, of an increase in colorectal cancers. In the Singapore Cancer Registry statistics, colorectal cancer is the #1 cancer among males now, and colorectal cancer is #2 cancer among females, and overall in the entire population it is the #1 cancer among the entire population as a whole. In this region in Asia, colorectal cancer has increased tremendously, the rates, and it is the fastest growing between the ages 25 and 50. And these are studies that have come out of countries like Australia, South Korea, even Europe, and even North America. We do look at epidemiological factors, and some of this would include sedentary lifestyle, would include high fat and low fiber diet, and would include obesity. Of course, an increasing rates of smoking and alcohol do contribute to colorectal cancers as well. Yes, I am actually. As you can see, almost all the factors that I've mentioned are actually lifestyle related, sedentary lifestyle. So I do recommend an increase in physical activity. We do actually work long hours. Some of us work 14 to 18 hours a day, but most of the time we spend on a chair and looking at a computer screen, and I think that's very unhealthy because of this, and this is related to our diet as well. Because we are so pressed for time, we usually order fast food. Fast food usually encompasses high fat and low fiber diet. So all these really have to change. We should take frequent breaks. We should go for exercise, if not every day, maybe 3 times a week. We should consciously eat lots of greens and lots of fiber in our diet. Bariatric surgery is actually a surgery for obese patients. Bariatric basically means weight loss or patients with increased weight, and surgery is doing a procedure for these patients. The reason why we do it is because statistics show that anyone above a body mass index of 32.5 will have only a 2% chance of losing barely 5% of their weight. So that's a lot of numbers there. Essentially what it means for a 100 kilogram patient whose body mass index is above 32.5, the chances of them losing 5 kilograms is 2%. So 2 out of 100 patients will lose 5 kilograms. And the biggest difference between diet and exercise and bariatric surgery is that this weight loss can be maintained over a long period of time. Losing weight is fairly easy, but maintaining it over the next 5 to 10 years is very, very difficult. So that's where the surgery comes in, and that's where close interaction with the doctor comes in. There are multiple factors that we consider before we recommend bariatric surgery to patients. One of them would include the patient's makeup, the history of the patient. For example, the patient must be fit for surgery. That is the first criteria. The next criteria, the patient has to be mentally prepared for surgery. And the third criteria is the most important. This would encompass a whole range of criteria, which would include the history and physical examination of the patient. History-wise, the patient has to be have to have a body mass index or BMI above 32.5 in the Asian context. In the Caucasian context, the body mass index is above 35. Secondly, they must have comorbid conditions if their body mass index is 32.5, and this would include diabetes, hypertension, high cholesterol, joint pains, knee and back pains, other obesity-related comorbidities. All these would help us push the patient towards bariatric surgery. Okay, this procedure is very safe. The reason being that we have lots of advancements in terms of surgery and pre- and post-operative care of these patients. Pre-operative care-wise, we have full evaluation of the patient, both with blood investigation, imaging investigations, and specialist evaluation for their various medical issues. Secondly, surgery-wise, the surgery has become very common. We are more proficient in the surgery, and the anesthetic care for these patients are very much more researched and very much more advanced. Post-operatively, we actually look after them quite thoroughly and quite carefully, and all these factors put together make the operation a very safe operation. In terms of percentages, the chances of getting a complication from bariatric surgery is way lower than having an accident when you cross the road, even if you look left and right 3 times.